Good afternoon, everyone. I'm Mike Stratton with Boulder County Public Health. I will be moderating the call today. Let me give you a few housekeeping items before we get rolling. All attendee lines will be on mute until we get to the Q&A session. When we do get to that session, please raise your hand, the Zoom hand, and we'll call on you. We will also have a chat function open for chat questions, and we will get to the phone questions once we get time for that as well. This meeting will last about 45 minutes. We'll do our best to get to all questions. If we do not get to your question, you can reach out directly to Chana Gusettis, PIO with Boulder County Public Health. You probably all know her, but her email is cgoussettis@bouldercounty.org. And just a reminder, the call will be recorded. If you need a copy of the recording, you can also contact Chana. On today's call, we have Jeff Zayak, Executive Director with Boulder County Public Health, Phil DeStefano, Chancellor with CU Boulder. We'll also be joined by Lexi Nolan, Boulder County Public Health Deputy Director, Trina Ruland, Boulder County Attorney, Jane Brodigan, Boulder County City Manager, Tom Carr, Boulder City Attorney, Shannon Albach, Boulder City Communications Manager, Russell Moore, Provost with CU Boulder, and Patrick O'Rourke, Interim Executive Vice Chancellor and Chief Operating Officer at CU. With that, I'll turn it over to Jeff Zayak for some opening remarks.
Thank you, Mike, and appreciate everybody tuning in today. So I have some really great news since the last time we've talked. Our numbers have significantly declined over the last 2 weeks since we implemented some of our strategies. We're still not there, but we're absolutely headed in the right direction. Our numbers are decreasing. We certainly anticipate we will get there with continued diligence moving forward. And the very first thing I want to do is just say thank you to our students and how much I appreciate the diligence, because it really does come down to individual behaviors, and you've taken responsibility, and it's making a big difference. And this is what will keep us headed in the right direction. So thank you to our students. I know this has been extremely difficult for everyone, and I know that this means sacrifices, and I really very much appreciate what you've done and how it's contributing to heading in the positive direction for our community that's going to make a difference for our society, our economy, and our personal and emotional health. So thank you to all the students who have taken this seriously and have really made a difference. You are making a difference right now. I also want to thank our partners. So we have done a huge amount of work over the last several weeks. Our partners with the University of Colorado, who have been in this 110%. We have been working very closely together. The City of Boulder, huge partners in this, critical, and really helping us figuring out how best to move the dial over these last several weeks, as well as Boulder County and Boulder County Public Health. So this partnership together is how we're accomplishing this. We would not have been able to do this individually. It takes the students, it takes this partnership between all of us to get headed in the right direction. So I just want to reaffirm how important that is and how much I appreciate the commitment we've all had together. As you know, we had a public health order that we issued 2 weeks ago that was specified specific stay-at-home for certain properties, as well as a limit on gatherings for 18 to 22-year-olds. That will expire tomorrow, and we will let that order expire. We will be issuing 2 new orders. One order that is focused on collegiate group homes, and it will require those collegiate group homes to provide a plan for how they intend to minimize spread of the disease moving forward. And that plan will help allow them to move out of that stay-at-home space. Another focus is a focus on varying levels of gathering restrictions that we've put in place that are really based on how well we're doing on our incidence rates in the 18 to 22-year-old population, as well as a series of other measures, including our testing and positivity rates. So that allows us, as we make progress towards those goals, to loosen restrictions more and more and more. And our goal is to get back to our baseline As I said, I think we are going to get there as long as we stay diligent and we continue to focus our direction like we've been focusing it over these last several weeks. I want to, again, just say how much I appreciate the work that we've done together. In addition to the orders that I just talked about, our partnership has been in development of strategies that is really going to help us monitor this information and pay attention to activities that are occurring so that we can respond quickly. And we will be posting this information on our website so that folks have access to it. But I really want to emphasize the importance of the partnership and the importance of what students have done to help us move in this right direction. And at this point, I'm going to hand it over to Chancellor DeStefano.
Sorry about that. Good afternoon, everyone. I want to begin by thanking our students who have been complying with local and state public health orders to reduce the spread of COVID-19. And I know this has not been very easy. It's been very difficult. I'm grateful to everyone at the University of Colorado Boulder and also in the surrounding community for their patience, for their understanding as we work to provide the safest and best experience possible for everyone, for our students as well as our community members. Since CU Boulder moved to remote instruction on September 23rd, there's been a significant decrease, as Jeff said, in our number of positive tests through our own on-campus diagnostics and monitoring tests. Violations in the residence halls have also been down these last 2 weeks, and summons on the Hill are also down for student housing, for students hosting large gatherings. And our CU student body has stepped up to the challenge in bringing down our positive numbers and our rates. As a result, we will transition from our current remote teaching mode of operation to in-person and hybrid in-person teaching on Wednesday, October 14th. We expect most classes to fully return to their original fall 2020 instructional modes, with the exceptions based upon specific public health requirements and individual faculty requests subject to departmental chair and dean approvals. This decision to move back to hybrid instructional model was made together with the Boulder County Public Health Department based upon a variety of factors, including our expanded testing to students who live off campus and to our faculty and our staff. If the Public Health Department eases restrictions based on their metrics in the coming days, we will also plan to host on-campus social events for larger groups of students practicing physical distancing and, of course, wearing face coverings. Our students' ability to have a greater social interaction also depends upon their continued participation in COVID testing and also in contact tracing. We believe that we have strong testing plans, and we know that individual behavior is the biggest determinant of success in the fight against the virus. So I encourage all of our students, our faculty, and our staff to keep up the good work as we transition back to person instruction by October 14th. So thank you.
Thank you, Chancellor DeStefano. Now I'd like to open it up to Q&A. If you have a question, please raise your hand, the Zoom hand down on the bottom of the screen. You can also put your question in chat. We will save time for questions on the phone. Regardless of how you ask your question, please be sure to identify your media organization. So it looks like we have our first question with Katie Langford.
Jeff, I had a quick question for you on the public health order around group homes, rather. With the language that's up right now, it's not clear if the health code is required as well, or if that's just required before they can get out of stay-at-home orders. Could you clarify that?
You were breaking up just a bit, Katie, so I'm not sure I could hear exactly what the question was, and I'm going to turn it to Kate after you ask it again. She's been
Yeah,
working on that order.
yeah. So I wanted to clarify, are these collegiate group homes required to submit these current regardless of what they get out of the stay-at-home order before it expires, or could you clarify that for me?
Absolutely, yes. So collegiate group homes will be required to submit a collegiate group home assessment to Boulder County Public Health. And all of the collegiate group homes currently under stay-at-home requirements will be required to submit a public health approved assessment before they're able to leave stay-at-home.
Okay, thank you. Our next question is with Elizabeth Hernandez. What's your question and what's your media organization, please?
Thanks. I'm Elizabeth Hernandez with the Denver Post. I am wondering, are some of these public health order restrictions and guidelines things that should have been implemented before there was an outbreak on campus?
So I'm happy to take the first shot at that. So before we had students on campus, we had done a lot of work in the months previously. An example of that was making sure that we had protocols in place. We worked really closely on outbreak guidance. We worked with the university on physical barriers, including separation, social distancing in schools. And we worked with the university on making sure we had contact tracing and case investigation in place. So we had fully hoped that we would be able to control the spread of the disease. And when we started to see the expansion of the disease, we knew it was time to step the amount of restrictions forward in order to stop it.
You're muted, Mike.
Of course I'm muted. Our next question is with Meg Wingerter.
Hello, this is Meg Winketer from the Denver Post. I had a question about the gatherings order. So it looked like the levels A and B and such, the requirements for that are a little looser than what the state was using for its cutoffs on the dial, but that the gathering restrictions themselves were significantly more stringent than in terms of the number of students who could be there. Could you tell me a little bit more about how this and what the state is ordering, the state framework for counties, how those are going to fit together?
Rena?
So our framework with these levels pertains only to the 18 to 22-year-old population within the city of Boulder. This exists within the state framework. Right now, Boulder County is within level 2 of safer at home. We hope to stay within that level, and that's the purpose of this order, is to keep us in that level and to bring down our numbers. And we're focusing on the 18 to 22-year-old population because that is where we're seeing the huge increases of numbers. The metrics that are identified within our levels for the 18 to 22-year-old population are based on a number of factors. They're based on what we currently see. When we had the peak of the surge, there were about 3,500 cases per 100,000 among 18 to 22-year-olds within Boulder County. So we have made this level step-down system to bring us back to a baseline level, which the epidemiology team has identified as, I believe, 250 cases per 100,000, which takes into account the fact that different age groups have different considerations and different risks around them. And it's also based on our contact tracing capabilities. So those levels were developed with those things in mind to bring us back to a place where we can get less and less restrictive gatherings over time among the 18 to 22-year-olds. So it works within the state system as kind of a smaller, littler dial specifically meant to address this surge.
Thank you. We do have a question from Brian Howe. Brian, can you tell us your organization and what your question is?
Yeah, this is Brian Howell from the Boulder Daily Camera. I actually have one question for the Chancellor and one for Jeff, if I could. First, for the Chancellor, you obviously worked with the Pac-12 CEO group on the things that they're doing there with the Quidel testing and everything. How confident are you that what the Pac-12 has in place can work in concert with Boulder County's regulations here?
Brian, thank you for that question. I am very confident about the policy and the procedures that the Pac-12 has adopted to return to intercollegiate athletics. And I'll hand it off also to my colleague Pat O'Rourke to comment about his work with the county on intercollegiate athletics.
So thanks for the question, Brian. The requirements from the Pac-12 are a baseline for us. CU Athletics has actually put in a very stringent series of test requirements for student athletes as a condition to be able to return to competition. We are working with the county and have submitted those protocols to the county so that they can review them. But we've been engaging in regular testing and other requirements for the student athletes, are seeing a really low positivity rate for them, and are prepared to work with the county and have them make sure that from an epidemiological standpoint that they would be comfortable as we return to competition and practice.
And then as a follow-up for Jeff, Patrick sort of answered my question in some ways, but I was curious what CU has to do at this point. I mean, as far as the Pac-12 is concerned, they're allowed to start practice on Friday. What does CU have to do to be able to start practicing football on Friday?
So they have submitted plans, and that's what they're required to do in terms of how they're going to assure control of the spread and what would happen when there is spread that's occurring. We have received those plans, and we anticipate being able to respond to those plans within the next 24 hours.
Great, thank you.
Thanks, Jeff. We're going to open this up to questions from the phone if we have any out there right now. If you do, please speak up. Okay, maybe not. We'll go back to questions. I'll remind you to either raise your hand with the Zoom function or type it in the chat function. We do have some follow-up, it looks like. Elizabeth Hernandez, would you like to ask a question?
Yes, thank you. In the Board of Health meeting a few moments ago, I believe Jeff Zayak said that there were around 200 investigations still ongoing for COVID-19 contact tracing and all of that stuff, regardless of the numbers dropping. During the surge of COVID-19 on campus, was the number of cases, did that exceed what the county and what CU could handle in terms of managing those contact tracing and testing?
So it didn't exceed it, but it certainly stressed us. And there's several things that we had to do. So under normal circumstances, we can handle a certain amount of cases in local public health just through Boulder County Public Health. Once we exceed that level, then we have to resort to the state to help us back up the investigations. But as I mentioned early on, we developed a system with the University of Colorado to have contact tracers and case investigators trained at the university. And I don't remember the exact numbers, but it's a significant amount. I think it was roughly 70 contact tracers and over 12 case investigators. I think the university could probably validate those numbers for me. But we did develop that additional capacity, acknowledging and expecting that we would have some outbreaks occurring as kids came back to school. So we did use those resources, we used our resources, and we have relied on the state resources as well to help us complete these case investigations and to complete contact tracing.
Thank you for that, Jeff. Katie Langford, it looks like you have another question as well.
Yeah, also following up from the Board of Health meeting, Pat, you mentioned there was an increase in student requests for mental health services. Do you have numbers on how much that's gone up? How much those requests have increased in recent weeks?
Katie, I don't have exact numbers on the request for services. I can check with our medical services folks and get you some data on that, but I wouldn't want to give you a wrong number without having a precise number.
Could you speak to what kind of outreach the university has done around mental health services in the past couple weeks?
You were breaking up, Katie. I couldn't hear the question.
Yeah, could you speak to what kind of outreach the university has done to students around mental health services in the past couple weeks?
Yeah, so our student affairs team has been doing regular outreach, particularly to those students who are in the isolation and quarantine, to be able to do checks on them, not only for their physical health, but their mental health. Those result in referrals where necessary over to the Wardenburg Health Center for them to be able to be connected to counselors. We've also widely disseminated information related to how students can access mental health services if they believe that they are in need of them and they are not otherwise in isolation and quarantine. It's also true that CAPS is offering a COVID-19 workshop series and is available for virtual crisis support, individual counseling, consultation, and other mental health services.
Thank you for that answer. Let's try the phone again. Is there anybody on the phone who would like to ask a question? If so, please state your media organization when you do. I guess that's a no. All right, we are actually currently out of questions. Last call here, folks. Raise your hand or put something in the chat if you'd like to ask a question from any of our folks here today. And that's also a no. So let me turn it over to Chancellor Stefano for some final comments.
Thank you, Ed. I just want to, again, thank our students. I'm very proud of the way that they followed the policy over the last 2 weeks. It's a real credit to them. And I also want to thank our partners. As Jeff said in the beginning, there was no way that any of us could do this alone. We had to work in collaboration with the university, the city, the county, to really make this happen, and it did. And again, I want to thank the county, the city, and especially though, I want to thank our students. And what we have to do is just keep up the good work, continue to do what we've been doing so that we can finish the semester strong and with our in-person hybrid model teaching. So with that, I'll turn it over to Jeff.
Thank you, Chancellor. And I just emphasize a couple points that you've probably heard me say before, and I may be a broken record on, but they're really important. And that's that we're going into a fall season where more activities will move indoors. We know that we will have flu mixed in with COVID, and we are not through this yet. We'll need to be diligent as we move into this fall time frame. So the key things, again, are if we're not within 6 feet of social distancing, then it's harder for that disease to spread. When we're wearing masks, it cuts it down further. And it's going to be really, really important as we move into the fall season that we follow those things. We use good hand hygiene. It's also going to be critical that if we do have outbreaks and we are doing investigations, one of the things that's absolutely necessary in order for us to keep control of the spread of the disease is for students or whoever's positive or potentially been exposed to support the follow-ups with folks that are reaching out to you. If we can't get contacts to follow up, then that disease can spread and it can put us all right back in the same situation that we're in now. And we need to be diligent about that. We need to keep following the guidelines, keep doing what you're doing right now. It's critical, and that's why our cases are going down. And if we can hold that, we'll have a better opportunity our fall. So that's my main message. And again, want to thank students and thank the partners as well.
Thank you, Jeff. I see that a very late question. Lucy Haggard, if you would send that question to Chana Gusetas with Boulder County Public Health, we'll get an answer to you. And Chana is also your contact. If you have Other questions? Or if you'd like a copy of this recording. Thank you and good afternoon.